Hi everyone, my name is Alexa.
And my name is Skylar.
We are recovery care nurses at Sioux Falls Specialty Hospital.
Thank you for putting your trust in our team for the very important procedure you'll be undergoing soon.
We're honored at the opportunity to take care of you. We take your safety, comfort, and recovery very seriously.
Our goal in this presentation is to illuminate everything you need to know as you prepare for spine surgery at Sioux Falls Specialty Hospital.
You should have received an introduction packet in an email or regular mail. If not, just let us know by contacting us at 605-444-8200.
Our goal today is to provide you with valuable information regarding your surgery, what to expect before, during, and after surgery, and how to best care for yourselves during that process.
First things first, the individuals that will be on your spine team, including your surgeon, their assistant, who may be either referred to as a PA, which is a physician's assistant, or an NP, which is a nurse practitioner, along with your anesthesiologist, who will discuss how you'll be going to sleep during surgery, what methods they'll use that day, and what approach they'll use to manage your pain. Additionally, our hospitalist or medical doctor will come around after surgery to check on you. You'll have a registered nurse and nursing assistants, along with discharge planning nurses, and then physical therapists and occupational therapists will also come around to work with you through this process. They form an outstanding team of professionals to guide you and care for you every step of the way. They're exceptionally trained, experienced, and highly focused on your well-being, and we're glad we get to work with them every day.
So when it's time to prepare for surgery, there are a few things you need to do. That starts even before scheduling for your surgery, such as a pre-op history and physical, mainly with your primary doctor. We usually like to see that within 30 days of surgery or sooner. Once you have that done and we schedule you for surgery, 2 to 3 days before your procedure, you will receive a couple of calls, one from our insurance department and registration as well, so that we can go over your medical history, medications you may be taking, and the time and place that you need to be that day.
Another thing to prepare for is your home. That means meal preparation, having some things set aside in the freezer that are ready to go when you get home. You'll also need to remove rugs, cords, and other tripping hazards. Make sure to have clean bed sheets and clean towels, as well as clean clothing to wear. Be sure to make arrangements for pets and mail well in advance. Equipment, walkers, canes, bathroom supplies. If you have any of those to help you while you're in the hospital, feel free to bring them in. But you do not need to buy equipment before the surgery because we do have staff here that will help you with acquiring such equipment.
Preparing your body. When we say that, we mean exercising and preparing the physical aspect of your body for surgery, such as having a healthy diet and good weight management. If you do smoke, the best day to quit is always today. Since you're getting ready for a surgical procedure, it's essential that you give yourself every advantage you can for a strong recovery. And that means no more tobacco. If you're worried about the challenge of quitting, we can give you some advice. Just ask. We are here to help. You'll be glad you did it, and your body will thank you for it. Whether you're a non-smoker or not, even if you have a challenge doing physical activity to get your heart and lungs going, you should be doing some breathing exercises throughout your day. Take moments every few hours for deep breathing at home, getting those lungs a friendly workout. It's simple and it feels great.
You'll have a pre-op appointment with your primary doctor to go through all the particulars you can expect during and after your procedure. His or her goal is to make sure everything is clear to you, that you have a good understanding of what's in store, to answer questions and to verify certain important necessities before surgery. For example, you will hear your physician and other members of the staff discuss the medications you're taking before surgery and which medications you need to stop taking beforehand, such as blood thinners and NSAIDs, which includes ibuprofen, also known as Advil. As good stewards to your health, we want to be very clear about the meds you need to discontinue in order to move forward with your procedure and ensure strong recovery. Please plan to shower or bathe the night before or the day of your procedure, or potentially both. Your surgeon might have specific instructions for you on bathing, depending on your unique needs. It's important for hygiene going into surgery, and it will help you feel good anyway. If you have nail polish on, please remove it. We'd ask that you take care of your nails before coming in for your procedure. If you have false nails, you'll need to have those removed too.
Feel free to treat yourself the day before surgery, but please, nothing to eat or drink after midnight the night before surgery. Of course, you'll hear from us by phone on all these preparations, and your surgeon will go through diet restrictions with you in your pre-op meeting. He or she will discuss any clear liquids like water you can consume before your procedure, so no food or drink after midnight the night before. As always, please don't be shy about asking questions. We're delighted to help make preparation clear and simple.
When the big day arrives and it's time to come to the hospital, there are a few things to be sure and bring. At the top of the list is your insurance card and prescription cards. Please make sure those come in with you the day of your visit. Our registration staff will ask you for them right away. They'll collect your insurance card and prescription cards from you so we can make copies for our records. Please bring all labeled prescription medications in their prescription bottles. Don't bring your pain medication though. You won't need it. We'll take care of you and make sure that you have the right pain medications during your stay in the hospital. Wear comfortable, supportive walking shoes and loose-fitting clothing, loose enough to fit over devices such as a back brace or similar items. If you're staying the night, pack toiletries. Leave perfumes and colognes at home. Bring only the essentials. And as with any trip outside the home, make a point to remember your cell phone chargers. We do have Wi-Fi available in the hospital for patients and guests. If you have a CPAP device, plan to bring it with you. If you use a walker right now, feel free to bring it, but be aware that we will provide you with one during your stay in the hospital if you need it.
Things to leave at home: large sums of money, valuables, and jewelry. Our focus is on your health, not your wealth. We'd appreciate it if you left those items at home. Also, don't bring vitamins or supplements. Leave your pain medications at home. We will visit with you often about the prescriptions you need when you're in the hospital, and we will provide pain medication you need. Finally, don't pack a large suitcase or bag. Try to keep it little or more modest in size.
So now you're packed, prepped, and ready to go. What should you expect the day for your surgery? First, remember nothing to eat after midnight the night before. Second, start your day with a shower, which should follow one of the night before. Our goal is to take every measure to cleanse the bacteria from your skin prior to your procedure. Back-to-back showers give us that much more of an advantage.
You should take any medications that your surgeon advised you during your pre-op phone call. We'll let you know the time frame that you're able to drink clear liquids such as water up until your surgery. If you have any questions about how or when to drink clear liquids, please let us know. Once you're at Sioux Falls Specialty Hospital, pull up to the front of the hospital and valet will park your car, and then you can proceed inside to sign in at our friendly registration desk.
Our staff will guide you next to one of our pre-op rooms. We'll give you some disinfecting wipes to use from your head to your toe just to eliminate any extra bacteria that you may still remain on your skin. We'll also have you use nasal swabs with iodine to eliminate potential bacteria contamination from your nose. At this point, you'll change into our hospital gown. Rest assured, as you're getting ready, our surgical team will be getting ready too. In a short while, you'll be ready. A nurse will visit with you to review all of your home medications along with your health history and verify everything is correct in our system. We'll collect your medications and lock them securely in the room that you'll be staying in after your procedure. We'll also keep your personal belongings secure while you're in surgery. You'll have them waiting for you in your overnight room as well.
Next, you'll meet your anesthesiologist. He or she will visit your room and discuss options for pain management, as well as how they will help you through your surgery and what forms of anesthesia they may have in mind for you. Your nurse will take your vital signs. He or she may also do a blood draw for lab analysis, and will start an IV in your arm. Finally, your surgeon will visit you to discuss your surgery beforehand. They may choose to mark your surgical site, or they may not. It just depends on how they would like to proceed.
And now it's time to get to work. You've completed all your prep. You followed every step up to this moment. Your expert surgical team is ready to give you the care you've waited for all this time. We'll now take a walk with you back to the operating room. After you're sleeping, they may or may not have to put an airway in place. Most likely they will. Your throat will be a little bit sore after surgery. That's normal and to be expected. During your procedure, we'll direct your contact person, that spouse, family member, or friend who needs to be there during your surgery, to wait for you in an area specifically designed for care persons. After your procedure, your surgeon will contact your care person, so let them know to have their phone charged and turned up so they don't miss the call. They'll be briefed on how the procedure went and how you're doing. Sometimes during surgery, they do what is called an intraoperative neuromonitoring that monitors your spinal cord nerves during surgery.
When surgery is complete, we'll take you to the PACU or post-anesthetic care unit. You may be there 1 to 2 hours, sometimes shorter, sometimes longer, depending on the surgery and how well you wake up afterwards. Our staff will take frequent vital readings, the basics like checking your pulse, temperature, and blood pressure. They will give you IV pain medications and warm blankets for comfort. You may have an oxygen cannula in your nose. You may also have what we call TED hose. These are long white socks placed on you after surgery to help prevent blood clots from forming. You may put those on before surgery too.
We will likely outfit you with what we call sequential compression devices. These are also a strategy to prevent blood clots. They squeeze your legs like a leg massage while you're lying in bed. If your surgeon approves and you're able to leave the hospital with your contact person that day, your care person or family will meet you in what's known as our step-down unit and can pick you up so you can go home after surgery. Otherwise, we'll bring you up to your room in the recovery care unit, where your personal items will be stored and your family can meet you.
And so the next important phase of your journey begins, recovery. As you begin to wake up, we help you get oriented to the room, let you know where things are, and set expectations on everything we'll go through on the first day. We'll do a nurse assessment, which includes listening to your heart and lungs, and of course, taking your vital signs pretty frequently. You'll reunite with your family, and we'll share updates with them. If they are not coming up to the floor, we can always communicate with them by phone. If you don't see your belongings in your room right away, just let us know because we're very good at keeping track of them and we'll get them to you right away. You'll have your own menu as well as a visitor meal. Every visitor gets at least one. We'll teach you how to get out of bed in a way that puts less stress on your back, what we call a log roll, which is keeping your shoulders aligned with your hips, rolling to your side, and getting up while keeping a straight back. You'll master this technique quickly, we're sure. We plan to have you walking within the first 6 hours. It's good for your back muscles and pain relief. Some people may come out of surgery with a Foley catheter in their bladder. That pretty much just keeps everything flowing as the systems in your body gradually start to wake up. Our team usually removes it the next morning, but always talk to your doctor if you have any questions or concerns. There's a good chance you'll see our team from physical therapy the same day, along with our nursing staff. Physical therapy will be the ones to help you move correctly. Walk is tolerated with our staff members. Walking is really important. It's really the best thing for you after surgery, so be ready to get up and at 'em. You might need to use a walker that we talked about, and then you will always have to have a gait belt on. It's a special device that lets our staff members accompanying you get a good hold to help support and direct your movements. When you go home, we want you walking quite a bit as well. The best time to get started on walking is early in your recovery at the hospital. Do not lift anything over 5 to 10 pounds, roughly equivalent to a gallon of milk. If you're considering lifting something that you're unsure if it's more than 10 pounds, it probably is, and don't attempt lifting it. Overall, avoid bending and twisting. We'll plan to reintroduce food gradually. Of course, you didn't eat much before surgery, and then after surgery, there's really nothing in you. But your body needs some time for all of its systems to wake up. Again, it won't be ready for a big feast, so we'll have a very light meal, such as toast, soup, jello, or similar available items quickly. If things go well and you're not feeling too sick to your stomach, we can get you a real meal shortly after.
Equipment in the rooms. You might need a little bit of oxygen. Again, things are kind of just waking up, so you might need a little bit of supplementary oxygen just to help reinvigorate your lungs. You'll have a heart rate monitor on the end of your finger, so again, no nail polish. We will keep an IV running most of the time you're recovering, So expect to have that IV in your hand, your arm, wherever it may be placed until you go home. You will have a bandage on your back, which might have to be changed out before you're able to go home. You may have a back brace ordered depending on what surgery you had. If you do, we'll fit one to you in your room and then you'll be able to take that home. You might have a drain placed in the incision site. It may be a larger drain known as a hemovac, which helps alleviate pressure that builds up after surgery. Alternatively, you might have a JP drain, which is a smaller drain than the hemovac, usually being cured for smaller surgeries. Whatever the case, the drain is removed before you go home. And let's not forget your legs. You'll have sequential pumps squeezing your legs to prevent blood clots, along with the TED hose, the long white socks. You might have and you might want an ice pack on your back. Just ask. They can really be a relief to the surgical site. Another thing that we'll give you right away is called a Volurex, or an incentive spirometer. This is going to help prevent pneumonia and work your lungs during your stay at the hospital. You're not going to be as active and easily moving as before, so having this and working on your breathing techniques will definitely help keep you very active and keep things moving in your lungs. And then again, a walker if you need it.
Post-op day 1 is what we call the day after your surgery. You'll have visitors, quite a bit of staff, coming in to see you that day. So you'll continually see the nurses throughout your stay, but physical therapy will most likely see you this day. They'll get you up, get you moving, walking on the stairs. They'll be the ones to help determine if you're able to go home or not, because we want to make sure you're safe. You will likely see personnel from occupational therapy as well. They help with any supplies that you might need at home. If you haven't seen our discharge planner, they're usually everyone's favorite person to see because they help verify everything you need to transition home. When you do leave the hospital, if you need any additional assistance at home, our discharge planners are the ones to talk to. You'll see doctors or the physician assistants. They work very closely together. You might just see one of them the day after surgery checking in on you to see how you're doing and evaluate how well the pain medications are working and discuss what you may need at home. Finally, you may see many patient care techs as well, usually side by side with the nurses. They'll be working together throughout the night to make sure many of your basic needs are met.
Part of your stay involves a variety of equipment to be mindful of. For example, those drains we talked to you about, those will most likely be taken out before you go home. And that does depend on how much fluid they're relieving. Your IV will be taken out when you go home. The Foley catheter will usually be removed the day after your surgery as well, so then you're up and going to the bathroom on your own. We may draw blood for your lab analysis the day after surgery. That usually happens pretty early in the morning because we want those results in before the doctor sees you, so they have a clearer picture of your condition. In terms of activity level, again, walking in the hallway is the way to go. You'll practice stairs, we'll change your dressing if needed, and then we'll begin to prepare for your care at home. In order to get you home, we need you to meet important discharge criteria. This includes ensuring that your pain is well managed throughout your stay and then at home as well. You can expect to have some pain. You won't be pain-free, but we want it to be managed, not an uncontrollable pain.
We'd like to see you eat and drink well before you leave. And of course, that includes being able to use the bathroom, voiding well, and yes, passing gas. Our physical therapist will make the call on whether you're in good condition and able to walk around at the appropriate level. We'll also monitor and evaluate any drain we may have left in your incision area. If that drain is still productive, we may keep you longer. It's all about proper care for proper relief. Generally, most people are able to meet our discharge criteria the day after surgery. Sometimes people do need to stay a little bit longer. Whatever your pace of recovery, it's important that you stay with us until you're really, truly ready to head home. When it comes to pain management, your nurse will be visiting your room frequently to ask what your pain level is. The scale he or she will use is very simple, 0 to 10. 0 is no pain and 10 is the worst pain imaginable. Your nurse will give you pain meds to see what works for you and how we can keep that number at an acceptable level for you. You'll want to be proactive with your pain medications, or as we like to say, staying on top of it. We never want to get too far behind. Generally, most people can take their pain medications every 4 hours, but each case can be different. Other things we might like to use would be ice packs. Those help with pain because they help with inflammation and swelling. Some of the pain medications that we may be using include narcotics such as hydrocodone, oxycodone, Dilaudid, Nucynta, and Tramadol. Those medications do have side effects, and a big one is constipation. Having stool softeners at home is really going to help you in the long run. Some popular brands such as Colace, Miralax, and Fibercon. You have a lot of choices. They may come with side effects like abdominal cramping or diarrhea. Other side effects to narcotic pain medication may include nausea, dizziness, drowsiness, and itching as well. It's essential that you do not do any driving or operate any heavy machinery while you're on the narcotic meds. Safety first, please. Non-narcotic medications may include Tylenol or different types of muscle relaxers, which may help with pain.
You can expect to take antibiotics while you're with us. You'll usually get 3 doses in the hospital, 1 during surgery and then 2 after surgery when you're up in the recovery care unit. And this is just for prevention of infection. Usually the most popular options are Ancef or clindamycin. Some side effects include rash, itching, flushed face, and nausea. Attempting to eat some food before you take these antibiotics will be helpful.
Your final step is to see the discharge planning nurse. He or she will come to your room to discuss what you can expect at home, what you can and cannot do, and if you need help. They'll visit with you the day of or the day after your procedure. They'll help order equipment if you need it, and then with any discharge needs.
An issue many people don't consider when it's time to go home is to choose a vehicle that is easiest for you to get in and out of, if you have options available for you. If you're a taller individual, a smaller vehicle is likely not the best option. If you're petite, you might not want to climb into a large pickup truck. Think about that in advance and plan accordingly with your care person.
You should have an appointment booked with your surgeon for approximately 1 to 2 weeks after surgery. We'll want to see how things are going, potentially take out any staples or any sutures that you might still have. As you're preparing to head home, we'll give you some dressing supplies and discuss signs and symptoms of infection. If you have any redness, swelling, pain, odor, pus, or if you have started getting fevers, those are big signs of an infection, so be watchful. If you do need extra dressing supplies, any pharmacy should be able to provide you with options. We recommend you give them a call first to see if they have those supplies on hand. When you shower at home, make sure you cover your incision site. We don't want your back hitting the water directly, so facing the water when you do end up showering is very important. We don't want to soak that area. Don't submerge or soak the wound. That means no baths, no hot tubs, or pools for that matter. In terms of activity and physical exertion, short, frequent walks are the path to recovery. No bending, twisting, or lifting anything greater than 10 pounds. When it comes to medication refills, make sure you call your surgeon's office at least 4 days before running out of supply. It can take a while to process refills through your insurance and provide validation for why medication is necessary through your pharmacy. Please plan ahead as much as possible. People typically do very well after surgery and usually are safe to go home in a predictable manner, but of course, everyone is different. We try to take you and your family's preferences into account. If a swing bed or home health services are medically necessary, we can help you set those up while you're in the hospital.
No matter how prepared you are for home, it will be an adjustment. You will likely experience anxiety and question whether you are ready to go home or not. Be assured that this is a normal feeling. We will do everything we can to assist you in this transition. Try to resist the urge to compare your surgery to anyone else's or even previous surgeries that you've had in the past. Each surgery is unique and everyone heals differently.
There are some frequently asked questions that many people have regarding their surgery. Let's cover those now. What if I live alone and I don't have anyone to help at home? We recommend reaching out to a friend or family member who can stay with you for the first 1 to 2 days after surgery. We would want them to be able to check in on you several times throughout the day in person, and you'll need a person to drive you home from the hospital.
What will I wear in the hospital and what clothes should I bring? You'll be in your hospital gown for the majority of your stay, but you should bring some comfortable, loose-fitting clothing, along with comfortable shoes, just in case your feet start swelling a little bit. That may happen after surgery, but make sure to pack looser-fitting shoes as well, such as sneakers or slippers or something similar, ideally with a good grippy sole.
Will I need to go to an inpatient rehab facility, such as a swing bed or skilled nursing facility after surgery, or will I need home health care? Our patients usually do pretty well and go home shortly after their procedure. If you have any questions regarding inpatient rehab or any of those services, feel free to contact our discharge nurses. You can reach them at 605-444-8205.
When can I resume my daily activities? You can increase daily activities as tolerated within your doctor's guidelines. You will go home with instructions explaining what you can and can't do, and for the most part, keep going as tolerated. As mentioned previously, everyone heals differently from their surgery.
When can I return to work or hobbies? Depending on your surgery, the timing will vary and you'll want to discuss with your surgeon. Make a point to bring that up with them.
When can I resume household and yard work? A lot of these activities can be very hard on your back, so if possible, you want to have someone else do the household chores and yard work until you have fully recovered. You'll want to ask your surgeon and make sure they approve of you getting back into household activities.
Do I have to do therapy exercises at home? There are no prescribed exercises upon discharge. Just make sure that you're walking pretty frequently. This is one of the best ways to heal and strengthen your back. It will also aid in relieving muscle spasms that you might obtain. We'll have pain medications for you to take at home. A prescription for pain medication will be e-scribed to the pharmacy of your choice. Sometimes they'll even provide you with a paper script for your pharmacy.
Will I be on antibiotics when I get home? Typically, you will not go home with a prescription for antibiotics. You will receive a course of IV antibiotics while here in the hospital.
When can I drive? Discuss this with your surgeon. You should not drive while you're on pain medications or narcotics. They impair your judgment and your ability to safely operate your car.
When will I get a call from the hospital before surgery? Your pre-operative phone call will usually happen 1 to 3 days before your surgery. The staff you speak with will ask you to verify your medical history and your scheduled procedure time for arrival.
Is there a place close by for my family to visit while I'm in the hospital? One family member may stay with you in the hospital at this time. If you have more than one family member with you, or if you live far away, the Center Inn Hotel is attached to the hospital and their number is 605-334-9002 to call and make reservations.
Thank you for choosing Sioux Falls Specialty Hospital. We can't wait to meet you.
If you do have any questions or concerns, you can always visit our website for more information.
Please take care, and we wish you the best with your spine surgery.